I'm Lauren Willis, the wife of the former England cricket captain Bob Willis, who sadly died of prostate cancer aged 70 in 2019. So we're here today to talk about prostate cancer and the symptoms and how important it is for men to get tested.
Graham, I was just going to touch on how men's health and prostate cancer particularly, has that affected friends and players that you've been in close contact with?
Fortunately, I've got no one in my family that has had that situation, but a lot of good friends, ex-teammates have contacted prostate cancer. Alan Lamb, John Charles, who played here at Essex, Jeff Miller, who played with Bob, as well as Alan Lamb, John Embry, who's probably my best friend. He's had a mild form of it, which they're monitoring at the moment. He's down in Australia. So it's a topic that we're all very aware of, and we all try and pass the message that you've got to look into it, you've got to get checked out regularly if there's anything untoward, even the slightest thing, that you can't take it lightly or just ignore it and have your head in the sand. You've got to get it checked out, especially at our age, quite advanced age, and hopefully the message will get round by what some sports like the Bob Willis Fund are putting that message out there, and people can take advantage of getting early diagnosis.
Thank you. And Lauren, what is the primary message of the Bob Willis Fund? What would you like men of a certain age, or as men get older, to know in your experience?
Well, the primary message, mainly because Bob was diagnosed, we think, far too late. By the time he had PSA tests in the past, they hadn't raised any suspicion, and then he had a urinary tract infection at the beginning of January 2016, and he had a PSA slightly raised at 6.2, which still didn't raise that many alarms. And then he had an MRI and a biopsy 3 months later to discover that he had, advanced aggressive prostate cancer that had spread to his bones, upfront chemotherapy, all sorts of appalling treatments, and he died 3 years and 8 months later.
PSA tests, how accurate, Rajiv, do you think? Do you see a lot of men with PSAs that are quite low with advanced disease?
Yes, I think PSA is not cancer specific, as I say, it's prostate specific. So even if you have an enlarged prostate, you can have a high PSA. But it's the only tool available at the moment, and especially in the community, that you can use for screening prostate cancer. So we have to take it with a pinch of salt. Raised PSA does warrant a referral to urologist, so they should come and see us, and it's up to the urologist how they investigate the patient further.
Yeah.
Are we close to getting another test that's going to highlight the problems quicker?
Rajiv, what do you think? I mean, is there an alternative to PSA?
So since many years, we've been looking into molecular markers, especially in urine, which could be the test to screen or diagnose prostate cancers. There's been many, some have come really close, but we still haven't found anything which is sustained or stood the test of time like PSA has. So nowadays, if I'm a very practical urologist, I don't do much research, but if you ask me what's the best tool available, I think it's the PSA and MRI. And if you have an MRI of the prostate, you can actually see how big your prostate is. So the bigger prostate it is, the more PSA it will produce. So we use something called a PSA density, which is the amount of PSA produced per gram of prostate tissue, which you can only deduct accurately by the MRI. So the PSA density, if it is low, your risk of having prostate cancer is low. But if it's high, then your risk is higher.
I mean, that's one of the answers we want, but the problem is getting guys to go along and have a test. We hear phone calls once a month that somebody else has got it, people that we played cricket with, and they're fit people, and they don't feel as though they're indestructible. They do feel as though they're indestructible, and they just don't want to go to the doctors. and they've got to be aware that it can attack anybody, anywhere, at any time, and they should be tested.
I mean, it's great having the unique perspective from male and also from wives and partners' point of view. What do you think men are afraid of?
Well, I think firstly, men mistakenly think that they're going to be invited for a prostate cancer test, and they're not. And then when they go there, often a doctor will say, well, why do you need a PSA test? Are you sure you need a PSA test? Have you got any symptoms? Personally, I think if you've got any symptoms, it's probably too late. They're scared of the DRE exam. I'm not sure that has to happen at stage 1 of the test. Literally, it should just be a blood test. Get your level, and that's the only way that the PSA test works, I think, really, is that you get a level at quite a young age. You have a test every year, is it, maybe? And if it starts rising, you know your own number and your own level is rising, because, you know, as I said, I think Bob's PSA should have been about 500 and it was 6.2, so numbers are irrelevant in this case.
What, J.K. Graham, what do you think? What would be your individual fear to go and see a doctor? Or even have a discussion with GP?
I don't have a fear at all, because I've been having PSA tests for, I don't know, a decade or more, probably longer, and I used to have a physical test by the doctor, which took 30 seconds. I don't think a lot of men would like to do that, but the only definitive way, as I understand it, I'd like to ask our specialist is a frequency of MRI scans. What would be practical and available? That's the difficult part with an MRI scan, because it's not an inexpensive test, is it? But that, as you said, is the only definitive way of finding out whether there is a serious problem.
Absolutely. MRI is not cheap, and MRI is not available out in the community. So you have to actually see a specialist to get an MRI scan done. But once you've had an MRI, we know what the baseline PSA should be based on what your prostate size is. And if you have any abnormalities on the MRI, then we would go on to investigate that by taking samples or biopsy the prostate. But if the MRI is normal and if your PSA density is low, then you don't need an MRI every year or every 2 years. It could be once every 4 to 5 years, depending upon your PSA. I think a baseline MRI, if your PSA is high, and depending on that, the urologist decides, or he can hand it over to the GP how often you need to come back if there is any significant change in your PSA. So baseline PSA and baseline MRI is good to have.
Obviously, you gentlemen had gone through the prostate pathways in terms of having the blood tests, having a digital X-ray. Is it as bad as you thought it might be? Right?
No.
Would you if someone was asking me, I'm a bit worried.
The test that we had done, the Professional Cricketers Association have a match day down at Worcester, and they put on the bottom, if you'd like a test, tick the box. So I don't know, I think there must have been something like 40 people who ticked the box, 1 or 2 who said yes when they got there. And I thought it was going to be a blood test, just one of those going back. And then 1 or 2 came out.
big pale.
Well, 1 or 2 of our characters, like Ray East, who came out, looked as though he'd just got off a horse. We said, "Is it all right?" Yeah, he said, "It's okay," but it took me by surprise.
Yeah.
But no, it was fine.
Probably best not to know going in.
Yeah, absolutely.
I mean, I actually think with getting the message out there, and I can only speak for myself, that if you've got children, if you get your children to get on your case, if you can target them, then the person's more likely to go and have it done. That's what I reckon. Your partner or your children, if they're aware and they are going to say, "Dad, we want you to do this," then that's quite a powerful message.
Yeah.
How important is talking to your partner and being open?
Well, I mean, I wish that I'd been more aware of prostate cancer before all of this. Obviously, it would be a different story now, but really important. And I think that the world of cricket is it's all sorts of, it's granddads, dads, kids, so everybody's affected by prostate cancer. Even if you're only 15 or 20, you can start, if you know about it, you can start asking your dad or your uncle to get tested, and your granddad and all that sort of stuff. So it's such an important message for all ages.
Rajiv, just because a man presents, and they may have a normal PSA, but if they've got symptoms of difficulty, or waking up at night, for example, or difficulty passing urine, is that something that would trigger, you'd want to go and see someone about? I mean, is that really important? If the PSA was normal, for example?
Yes. So remember, 1 in 8 men get prostate cancer, but more common than that, 1 in 4 men see a doctor or GP for symptoms related to enlarged prostate. Early prostate cancer doesn't have any symptoms, and most men who come to us have gone to a GP because they've got some urinary symptoms and they have a PSA or prostate blood test screening test done, and they find it's high and they come and see us. So enlarged prostate symptoms are more common, and that's how men present initially. So yes, and if you leave them too long, they can have adverse impact or consequences. So if you have those symptoms, you need to see a GP or a specialist so you can get started on some treatment. Remember, every man doesn't need treatment. Some symptoms settle down with lifestyle changes or modifications, fluid management advice. So those are the things that men should go to see a specialist or a GP.
Lauren, you said an interesting point. Bob had a urinary tract infection, right?
Yeah, we've had a few of those. I mean, do you think that that's a sign of prostate cancer? Nobody ever suggested that, but
Yeah, I mean, Roger, we do see patients in the clinic who have a poorly emptying bladder, and certainly the general practitioners, the advice that we would give is to refer patients with UTIs, recurrent UTIs, because they may have an underlying problem. And as you say, prostate cancer at very early stages hardly gives any symptoms.
yeah, I mean, Bob definitely had a difference in his urine flow, and he and I should have picked that up more quickly, because I think that's a really obvious sign, isn't it?
Yeah.
That's not just getting up at night to
No, it's
for a wee.
It's going from being like a horse to a bit ploppy.
Okay. Okay.
Yeah.
Yeah.
So going back to the urinary tract infection point, I think urinary tract infection happens generally because you're not emptying your bladder very well. That sort of invites bugs into your system, and you get the urinary tract infection. Now, the most common reason in men, so it's in women, urinary tract infections are very common without any cause. 90% of women don't have a cause to get a urinary tract infection, but with men, it's the opposite. So if you have urinary tract infection, there's something usually wrong. So in a particular age, it's usually the prostate. So it's benign enlargement first is still the cause, but in advanced prostate cancers, they can squeeze on your system, the urinary pipe, and produce infections. So that's probably.
I think in hindsight, he should have gone to see a urologist 2 or 3 or 4 years before he did. It was the final urinary tract infection that started the ball rolling. But yeah, I wonder whether that was missed, because he would have had a PSA test, it would have been low, and that would have been the end of it. He had some antibiotics, and he was better again. Yeah.
And from your research, and obviously working with the Bob Willis Foundation, what are the groups of men that are really, you feel, should be going out there and really knocking on the door, saying, are they particularly high risk groups?
Yes, the high risk groups are black men. 1 in 4 black men will get prostate cancer, and something like 80% likely to even get tested in the first place. So they're at serious risk, and then men with a family history of prostate cancer. So Sir Chris Hoy's granddad died of prostate cancer. His dad had prostate cancer, and he hadn't had a test before he discovers he's got terminal prostate cancer. So that's worrying, isn't it? Especially somebody like him who must have seen millions of doctors over the years. Scary. So for Bob, I don't think there was no family history. His brother's older than him. He hasn't got prostate cancer. His dad died at age 70 of a stroke. Probably never even had a PSA test. So there was nothing to suggest that he was at risk of this, extremely aggressive prostate cancer. How likely are you, if you're playing golf, for example, with a group of men, how likely are you to discuss prostate cancer, and have you had a PSA test? Extremely unlikely.
No, the number of times I have to stop and hide in the bushes for a few minutes is some sort of key that there's something wrong.
Yeah.
But certainly, what we're talking about, to lose somebody that you're very close to, that went through the whole cricketing circle when Bob went. That went everywhere, worldwide, through all the cricketers. So, yeah, bless him. He's put a message out there for us to follow up, I think.
And tell us a little bit about your memories with Bob, right? And I'll go on to Graham in a bit, right? What was it like, sharing a room with him?
We're still on camera. He made my life as a real rookie, but as somebody who got fairly homesick on early trips. He made everything so much easier. He had a great sense of humour, and he helped pass some of those long evenings where sun comes down in India or Pakistan 6 o'clock, 5:30, and it's a long night. The only thing you've got to look forward to is that evening meal, and you've got to entertain yourself and other people. And he was brilliant at that, and.
You like games and
He was just
hunting down Campari.
I remember when he got the job as a commentator, and he sounded a little bit, should I say, a little bit dour. And people said, "Oh no, that's not the Bob I know." I said, "Well, it's certainly not the Bob I know." And then he changed as he got into the job a little bit later on. But no, he was full of fun, and I think everybody ever played with him missed him greatly.
Graham, what was he like to face? You obviously your opposition had to face him at his fiery best as a opening fast bowler.
I actually don't remember playing. I remember playing against him once at somewhere, not Edgbaston when he was playing for Warwickshire, somewhere else, Nuneaton or somewhere like that. And but obviously I played a lot with him from when I came back into the England Test side in 1978. And I found him as a sort of inspiration as a player, because he'd made his Test debut in 71 when England won the Ashes, but of course he was a rookie bowler then playing with Surrey, and I think he realised that he wasn't fit enough and he wasn't strong enough to do the job, and he changed. And I'm a great believer in life is you evolve yourself. And he was a great example to me of how you evolve yourself. So at the beginning, he had talent, he had pace, he was tall, so he got bounced as a fast bowler, but he was not the finished article. He had to work at his fitness. And I never forget, first time I went to Australia, he couldn't sleep in the South Lodge, Travel Lodge, I think it was, in Adelaide, and he was up at 3 o'clock in the morning, running around the field in the dark to build his stamina up for what was ahead, 6 Test match tour. But he was fun off the field, and I can thank him for one thing. I know he changed his name and added Dylan to it, but he introduced me to Van Morrison. He's still my favourite now.
Yeah. Obviously, lots of memories, and I mean, what do you think, if Bob was here, what sort of message do you think he would want to pass on to men, right? What do you think?
It'd be quite straightforward.
It's like, I used to watch him at the Verdict, and he was
it would be great to have him doing a verdict
exactly
with prostate cancer.
I would love to see him do that.
Because when he got diagnosed, I think part of it is it's really hard to accept this. I mean, they never talked terminal, but in hindsight, it was a terminal diagnosis. And we didn't really want to tell anyone, especially me. I didn't, we told friends and family and everything, and his colleagues, but it wasn't public knowledge. And, probably we could have done better work if he was alive and he could have talked to people. So he has had no choice or say in what we've done since he died. He didn't know that we were going to do this. But, he was he was loved, and I mean, when he died, the outpouring of grief was unbelievable, and he was loved, and he was a sort of hero, and we really felt that cricket and his message could save some lives. So that's really where it all started from. And it's unbelievable the number of how helpful everybody is, because they did all love him. He never knew that he was so loved, but it's been amazing, really.
But Rajiv, you see a lot of patients in the clinic with very early prostate cancer that's been picked up, and we're very lucky to work in a healthcare system like the NHS or even privately, where we have patients who have gone through pathways. I went to India recently, and the urologists there, 70% of their patients were metastatic, where the cancer had spread on first presentation. Right? But we're very lucky to work in a country, in an institution where we've got these. What percentage of patients are actually advanced or real prostate cancer?
So in England, around 1/3 or around somewhere between 30 to 35% of patients would present in advanced stage disease, and I think most of them usually come to you either because they've had some urinary symptoms and the GP's done a PSA and it's quite high, and then you see them and they have all the workup. Some of them present to other specialties, say for example fractures. Some people present with pathological fractures, or they might present with spread of cancer to a different organ, like the lungs or the lymph nodes, and then presentation as a result of that. Yeah, so overall, I think quite a lot of people still present in advanced stages in England.
Yeah.
I mean, Chris Hoy had a shoulder injury, didn't he? You wouldn't ever put that together with prostate cancer, would you?
See, men are quite, I'd be reticent to take medication or, have surgery, but now surgery is, even for the benign prostate, is changing quite a bit. Now we have these day case procedures with most men come to tell us that I don't want to have a risk of incontinence. I don't want to lose my erections or have, problems with my ejaculation. Is that one of the key concerns that most men have? Because, we're proud of our...
Well, I'm not a man, but I would think it was the absolutely most important thing. I mean, I do really think the prostate hits men exactly where it hurts.
Yeah.
Your thoughts on that?
I agree. I think that's where we're very reticent to go along, because we've seen, as I said, the stories you hear are old hat now, and there is a way forward, and we should go out and embrace that way forward.
From our surgical side, over the last 10 years, right, things have really changed. Not just diagnostics for prostate cancer, but treatments for men and their benign prostate, which is far more common. If you look at 50% at 50 have some sort of urinary symptom, 60% at 60, 70% at 70 will have, and treatments like day case steaming the prostate 15 minute, with very few sexual side effects or incontinence side effects, clipping the prostate, or even not even having an operation. You can have an interventional procedure by a radiologist down your arm, which would shrink the prostate down. So, and as Graham mentioned, there are medications to relax the prostate or shrink the prostate down, which do take some time. And how much of it, Graham, do you think is trust? Right? Just like, I suppose, the captain used to trust you as the opening batsman, get me some runs, right?
Oh, sure.
Or throw the ball to Bob and say, get me some wickets, right? How important is trust?
Life's built on trust, isn't it? You trust and you build relationships. It's like if you're coaching or you're helping anyone in any walk of life.
If you've got a financial advisor who don't understand anything, you have to trust them to give you advice.
Well, I think you have to build a relationship to a degree, even though with a doctor or a consultant, you've got to believe them. You've got to believe in what they're going to say, aren't you? So, in my world, when I don't do coaching now, but when you do, you can't just go in and go tell. You've got to build a relationship with the person, so you can influence them and they have that trust. So I think to a different type of degree with a consultant, you have to believe in the person as well as the treatment.
If you guys had your time back, and now, for example, insurance companies, often if you work in the city, you get an annual medical, right? And is that something cricketers would, or as you say, Chris, with all the blood tests and everything, if you were working in whatever industry, is that something you would encourage just to get your cholesterol, because now we know a lot of these diseases are prevented, and if caught early, be it diabetes, heart disease, prostate cancer, all of these things.
When I played, we had medical cover.
Yeah.
You retire, it's gone.
Yeah.
Straight away. Moved into the school system, had medical cover. Retire from that, it's gone.
Yeah.
It is so important. It really is. It puts your mind at rest, and you're quite happy to go along and have because it will be your wife or partner that says, you know, you're not walking very well, or you're getting up too many times a night, whatever it is. Hopefully they're the ones that push, and you will then say, well, I'm not going to sit in a waiting list for forever.
Yeah.
If I can go to see the bursar and say, look, I need a test for this, then
Yeah, so and if you are do have private health insurance, can you just tell us what your clinic, how quickly you can do a PSA?
Or a PSA,
Or a prostate.
For example, if a patient saw me this morning, you could do the digital rectal exam, the examination, take the history, do a risk-benefit ratio. Often now with apps, you can do a little bit of a calculation. What's your PSA, your family history, what your chances of prostate cancer? You can do the digital rectal examination all within 15 minutes. Have the blood test as you leave, the results back next day, the day after. An MRI could be done later on in the week, as a clinically urgent patient. And within a week, you will get a good idea. And probably within the next week after, you could have a biopsy. Now, once you've had a biopsy, it's usually about 2 weeks, right? So the whole journey, you know, and most people will have a PSA test, an MRI scan, and that will be it, right? If the PSA is elevated. So a lot of people will go after party, and within a week, you will know. Right? Rajiv, is that?
I think we both do on the private side, we both do something called a check for cancer, which is initiated by the insurance company, similar to the 2-week wait on the NHS side. So when we get the referrals, we actually know the PSA, the history. So a lot of these patients, we can actually book the MRI on the same day they come and see us. We might not have the report the same day, but at least everything's done on the same day. So yeah, so it can be as quick as that.
If you're a partner, brother, sister, or friend, and you have got symptoms, you push them to have that conversation, right?
Definitely. And you know, I've sort of heard of people who've got symptoms and then they're told that the PSA is fine, and that seems to be the end of it. And I don't want to scare them off, but you know, I slightly concerned that that's sort of Bob's situation, that he had symptoms, the PSA was obviously okay, go down the road for a few more years, and then it's too late. So yeah, I just think everybody needs to know, and it's up to them to decide if they do anything about it or not. That's all we can do, is awareness is key, isn't it?
And Graham, from your conversations with your mates, and what would you be your message, your kind of, you know, to other men out there who are, sometimes struggling or not sure, you know?
Well, I think as a younger man, you probably don't think about those things, and you think about other things in life. But as the years advance on, you've got to consider, the diseases and situations that affect more men as you get to an advanced age, and you've just got to be tested, haven't you? You've got to be checked out for all the things you've mentioned, as well as prostate, because inaction is your enemy, really.
JK, any thoughts?
I think so. You've got to test. It's in your hands.
Yeah.
Dementia is on the rise. You can't do anything about that. This you can do something about. So get it done.